Ebola outbreak has spread across West Africa, impacting hundreds of thousands of lives. It is on the front pages of newspapers and on the minds of people around the world. Based on the Ebola response plan by the WHO, the main pillars of actions to contain and control Ebola must include both short-term and long-term measures. The priority actions are in full community engagement for risk mitigation, full infection prevention and control at all levels of care, and case management by trained personnel. In line with the WHO response plan, Umcor has responded to this epidemic by giving out grants totaling over $400,000 to support actions in breaking disease transmission. Umcor's grants support community education, health worker protection, and psychosocial support for affected people and their families. In partnership with the health boards in Liberia, Sierra Leone, and Côte d'Ivoire, the Global Medic and ACT Alliance, Umcor has supported the procurement and delivery of 140,000 gloves, 48,000 protective suits, as well as supported the construction of holding units, provided 10 pop-up tents for overflow, and allowed for the training of more than 1,200 people in various capacities. It is easy to be overwhelmed by these numbers, but when dealing with human lives, numbers become important. Numbers become names. The key to winning this fight is to prevent new infections. This is a difficult task in West Africa for several reasons. There is the distrust of the health system, the government, and foreign organizations. Therefore, messages about Ebola containment from these sources are often not taken seriously. Because contraction of this disease is viewed by many as a death sentence, denial is rife, and families hide cases rather than seek care, thus encouraging continued transmission among contacts. Given the historic role of religion in these countries, faith communities are important in providing the community education to impact behavior. Communication to those in affected areas is important, but just as crucial is how we let Umcor donors and the Methodist Church know how to help. There is a need to coordinate our response by giving through Umcor. Umcor works directly with our partners on the ground in the affected countries to provide the resources to purchase necessary supplies locally. When that is impossible, Umcor has identified ways to import specifically requested items into the country. This approach ensures the appropriateness, timeliness, and quality of materials. It also avoids inclusion in shipments of used, damaged, out of date, or otherwise inappropriate items. In a recent open letter, Bishops Innes and Yambasu of Liberia and Sierra Leone have also urged donors to give through Umcor. So again, while supplies, isolation tents, and training will ultimately help end these outbreaks, it starts with communication. That message is a simple message, but a message can save lives.